This presentation aims to explain tooth extraction at the Tokyo International Dental Clinic in Roppongi. If you watch this video and agree, please fill out the consent form for the extraction. If you have any further questions, please ask us. This video explains the risks during and after tooth extraction and the pain, treatment fee, and time required. The most important thing after the tooth extraction is blood control. After the tooth is extracted, bleeding occurs, and blood accumulates in the extracted cavity. We ask you to bite the gauze for 30 minutes to stop the bleeding. Usually, the bleeding stops in 30 minutes, and a coagulum will form on the wound surface. Please remove the gauze carefully. You can spit saliva when you have a bleeding taste. But please don't rinse your mouth to keep the coagulum on the wound. If the coagulum comes off, the blood also comes off, increasing the chance of creating an infection. If all the blood is gone and the food and/or bacteria accumulate in the extracted cavity, you will have severe pain for months. Please be very careful after the tooth extraction. Usually, you will have some pain and/or swelling for about 2 to 3 days. Sometimes, the extraction takes time, so that TMD symptoms may appear temporarily. The root can get fractured during extraction, especially when it is thin and curved. Don't worry, we don't have to remove the fractured root if it is not infected. A part of the tiny bone can also fracture during extraction. Sometimes, it comes off later. It's no problem, and it usually heals. If you have a lot of bleeding after extraction, an intrahemorrhage may occur. The skin may temporarily turn blue or yellow, but disappear in 1 to 2 weeks. If you have a crown on the neighboring tooth, the crown may come off or be damaged during extraction. We can put it back or repair it. Communication may occur temporarily when the tooth's root is close to the maxillary sinus. It will heal naturally. If a tooth is removed close to the big nerve, a nerve symptom like paralysis may occur. You may be asked to take a CBCT radiograph to determine the tooth's position relative to the big nerve. Sometimes, we decide not to remove it. Significant swelling may occur when the high-speed turbine cuts the tooth. This is rare, and we have never experienced it, but it may happen. Other unforeseen circumstances, such as shock, stroke, or allergy, may occur. If you have any previous experience, please report it to us. The treatment is covered by Japanese insurance, but the fee varies depending on the situation. It is usually within 10,000 yen. The private treatment costs 10,000 yen to 30,000 yen plus tax. Please call us immediately if you develop any severe clinical signs, such as bleeding, severe pain, or significant swelling. Thank you very much for listening to the procedure for the tooth extraction. If you have any further questions, you can discuss them before the tooth extraction. Otherwise, please fill out the consent form for the tooth extraction.